We had a patient come to us that had a disc herniation surgery about 18 months ago. And now he was having fairly severe recurrence of his pain. The pain came on while he was playing tennis. He's a very active gentleman, and began to get worse over the course of a few days. His MRI scan showed a recurrent disc herniation. So what is the chance of having a recurrent disc herniation, and how is it treated? Patients that have a discectomy surgery in the lumbar spine, we usually will quote an 8% risk of the disc herniating again. Sometimes I'll say, well, in this particular case, your risk might be a little bit higher or a little bit lower than that baseline 8%. Recurrent disc herniations present with similar symptoms as the patient had with the initial disc herniation, only sometimes they're worse. And I think the reason they're worse is the nerve has some scar tissue around it, and the disc herniates into the nerve and it has nowhere to go because the scar tissue is tethering it. There's really three options when a patient has a recurrent disc herniation. One is to go back in and remove the recurrent herniation. Another is to remove the herniation and do a fusion. And the final one is to remove the herniation and do a disc replacement. We can counsel with each individual patient as to what our recommendation might be. This patient's particular disc herniation was at L5S1, and I thought he would be an excellent candidate to do a disc replacement rather than a fusion or a redo disc herniation surgery. So we went ahead and did a disc replacement. That's done from an incision in the front of the spine through the abdomen, and we went and removed the entire disc and the disc herniation, alleviating the pressure on the nerve, and then replaced the disc. I like this option if it's possible because we are restoring the motion and structural integrity of the disc. A disc that has herniated twice or more times typically does not have normal structure and function anymore. And doing a disc replacement theoretically can restore that, and the patients can have an excellent outcome. So when possible, I prefer to do a disc replacement for a reherniation. Sometimes we need to do a fusion. Sometimes we can go back in and remove another fragment without doing a fusion. We do, again, take each case on a case-by-case basis. This particular patient had an excellent result with a disc replacement in his lumbar spine.